Hi, my name is Brittany and I'm going to be a nurse doing a head-to-toe physical exam assessment on you today. Can you tell me your name
Aaron Thompson,
and your date of birth?
July 1st, 1993,
And can you tell me what year it is this year?
2019,
And who's the president?
Donald Trump.
Okay, good. Patient appears alert and orientated ×4. Affect is appropriate for situation. He has good posture, well nourished, and well groomed. He seems pleasant. I'm going to go ahead and start by assessing the skin. It looks good color, warm. Arms are warm to touch, legs are warm to touch. The face looks symmetrical. I'm going to go ahead and start by feeling your scalp here. There's no lesions, no bumps felt. The eyebrows and eyelashes have hair on the face. There's mustache and beard. I'm going to go ahead and start by looking at your eyes. I'm going to have you look straight ahead at me. Just over my shoulder, I'm going to go ahead and shine this light right in your eyes. Alright, pupils are equal in size and reactive to light. I'm going to have you go ahead and look at my pen light and follow it in. Alright, good accommodation. Cornea reflex is intact in both eyes. I'll have you go ahead and cover one eye for me. And then I'm going to have you watch my fingers as they wiggle and tell me when you can see them.
No. 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 No.
Okay, good. Go ahead and switch and cover the other eye. We're going to do the same thing. Just tell me when you can see them.
No. 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 No.
Okay, good. Now I'm going to have you go ahead and look at my fingers without moving your head at all and just your eyes. Go ahead and follow my finger. Okay, good. And the iris appears blue. The sclera is white. There's no reddening of the sclera. There's no discharge, no inflammation of the eye. I'm going to go ahead and feel the sinuses here. Do you feel any pressure at all?
No.
Okay. The nose appears midline. I'll have you go ahead and close one nostril for me and take a breath. Can you breathe good out of that one? And go ahead and close the other nostril and take a breath. Can you breathe good out of that one?
Mm-hmm.
Okay, I'm going to go ahead and look up your nose with the pen light. There's no obstruction noted at all. And then I'm going to have you go ahead and cover one eye again. I'm going to have you read this paper for me, the smallest print you can on there.
EDWBC.
Good. And then go ahead and switch to the other eye and go ahead and read the smallest print you can with that one.
EDWBC.
Good. Thank you. I'm going to go ahead and just look at your ears here. There's no lesions at all. I'm going to go ahead and feel them. Are they tender at all?
No.
Is the tragus tender?
No.
Okay. Just going to go ahead and feel for lymph nodes. Okay. No lymph nodes felt. Go ahead and feel the carotid pulse one at a time. That side is present. And this side is also present. Trachea is midline. Okay, now I'm going to have you go ahead and stick out your tongue for me. Tongue appears midline. Go ahead and say ah. Uvula rises midline. Tonsils are grade +1, barely visible. Go ahead and open one more time for me. Gag reflex is present. I'll have you go ahead and clench your jaw for me. Okay, good. No TMJ noted at all. Gonna have you go ahead and shrug your shoulders for me. Okay, good. And then I'm gonna have you go ahead and raise your arms out towards you. Can you raise them up over your head? And then back down to the middle, then out to the side? Okay, good. Good range of motion. Any pain at all?
No.
Okay, and then go ahead and move your head to the left and right, and then up and down, and then in a circle also. Any pain at all?
No.
Okay, good range of motion there. I'm going to go ahead and take a look at your back now. There's no lesions noted, no scarring. There is a tattoo down the middle. I'm going to go ahead and take a listen. I'll just have you take a few deep breaths for me. Okay, good, thank you. Just gonna have you go ahead and say the word 99 for me.
99,
Again,
99,
again,
99,
and one more time.
99.
Thank you. Now I'm gonna have you go ahead, when you feel my stethoscope on your back, say the letter E for me.
E, 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 E.
Okay, great. I'm just gonna go ahead and percuss the back. And I'm gonna go ahead and hit on your lower back. Just tell me if it hurts at all.
No.
Any pain?
No.
Okay. Now I'm gonna check your hearing. I'm just gonna go ahead and whisper some words if you can repeat what I'm saying to you.
Thanksgiving. Christmas.
Okay, good. Now I'm gonna go ahead and take a look at the anterior of the chest here. There's no lesions at all. There is a tattoo on the left upper chest. I'm gonna go ahead and take a listen to the lungs. Go ahead and take a few more deep breaths for me. Okay, good. Lung sounds are clear anterior and posteriorly. Go ahead and take a deep breath for me. Lungs rise symmetrical on the both anterior and posteriorly. I'm going to go ahead and listen to your heart sounds now. First, I'm going to have you tell me, do you feel any pain when I'm touching your chest at all? Okay.
No.
I'm going to go ahead and start at intercostal space 2, intercostal 2, intercostal 3, intercostal 4, and intercostal 5. Okay, S1, S2 is present. There is no murmur heard. Going to feel the pulse at the apical spot. 5th intercostal. Apical pulse is present and bounding. Gonna feel on the left of the chest. There is no thrill or heave felt. Okay, I'm gonna go ahead and feel the arms. They are warm. Radial pulses are present bilaterally +2. Capillary refill is less than 3 seconds. I'm going to have you go ahead and lie down for me now. Have you set up a little bit. No JVD noted at 30 to 45 degree angle. Have you go ahead and lie down. I'm just going to look at the abdomen now. It does appear flat in appearance. There's no lesions or scarring noted. I'm going to go ahead and listen now to bowel sounds. Starting at the right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. Listening with the bell for bruit. No bruit noted. Going to go ahead and percuss the abdomen. Tympany heard throughout the abdomen. I'm going to go ahead and palpate now lightly. Tell me if you feel any pain at all.
No.
Okay, I'm going to go ahead and palpate a little bit firmer. Any pain at all?
No.
Okay, good. Now I'm going to go ahead and feel for the femoral pulse. Femoral pulse is present, +2 bilaterally. Feel for enlarged lymph nodes. No lymph nodes felt. I'm going to go ahead and look at the legs now. They are warm, equal in color bilaterally. Feel the pulse, pedal pulse is present. Capillary refill is less than 3 seconds. I'm going to go ahead and check your reflexes now on the bottom of your feet. Okay, good. I'm going to have you go ahead and raise this left leg up for me. And then if you can move it in towards your chest. Good. And back out. Any pain at all?
No.
Okay, good. And then go ahead and do the same thing with your other leg. And back out. Okay, good. Any pain?
No.
Okay, good range of motion there also. I'll have you go ahead and sit back up on the side of the bed for me. I'm just going to go ahead now and have you close your eyes, and I'm just going to touch you with the cotton ball. Just tell me where you feel it at.
Forehead, left cheek, right cheek, left arm, left leg, right arm.
Okay, good. Now I'm going to have you go ahead and stand for me. And what I want you to do is take your hands and move them as fast as you can, just in and out. Okay, good. Now I'll have you walk away from me. Just going to check your balance. Balance is good, posture good. I'll have you walk towards me and go ahead and put your heel to toe in a straight line. Okay, good balance. Now I'm just going to have you go ahead and stand completely still for me. Close your eyes for 30 seconds. Okay, good. Good balance. Now I'm going to have you go ahead and bend over, kind of touch your toes. Good. And then go from side to side. Alright, any pain at all?
No.
Perfect. And then go ahead and sit down for me. I'm just going to check your other reflexes. Good. 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 And then your Achilles. Alright, good. Well, that's going to complete our assessment today. Thank you so much.
Thank you.